Now I'm joined by Dr. Abdou Sebushishe. He's Senior Global Health Advisor for the International Medical Corps, and he's on the ground there in Goma in the DRC. Doctor, it's good to have you, and you will have heard Clarissa's report there from the red zone, effectively. Let's start with that situation on the ground and these local efforts to respond. The WHO says there are 321 confirmed Ebola cases in DRC, over 100 more suspected cases. Can you just further provide some detail on the measures being put in place? And do you believe what's being done is sufficiently effective at this point?
Thanks for having me. So far, there are a lot of interventions that have been put in place. That inclusive of deploying capacity to isolate patients safely and care for them. And the International Medical Corps, together with other partners, are supporting the local authorities' effort to ensure the containment within isolation facility and enough bed capacity to isolate patients who are being identified. But also, there are more efforts in providing supplies, the prevention, infection and prevention control supplies, as well as the personal protective equipment required for healthcare workers to be able to enter the red zone. As you can see, currently I'm within one of our transit center, Ebola transit center, in one of the major hospitals in Goma, and we are setting up a triage system to ensure that every patient who attend this facility go through a screening for Ebola, and if he's suspected to be Ebola, we put him in an isolation and collect sample for testing. These are part of the measures that are being put in place. However, there are still a lot of challenges, especially related to contact tracing, where we have fewer contact of the positive cases that are being monitored so far, and then the majority of them are still missing, and efforts are being made to ensure that they are being followed up, because those can constitute a risk as they've been contacted. But also another challenge, I think, that I should mention is related to... Yeah,
go on.
I was mentioning that one of the major challenge here is related to the supplies and infection prevention control supplies, but also personal protective equipment for Ebola clinic, but also for non-Ebola clinic that have to provide ordinary care.
And I know that efforts on your organization have been hampered, I mean, by these PPE and supply shortages. This latest outbreak is the 17th outbreak the DRC has dealt with. It came very shortly after another Ebola outbreak there. How are you dealing with these shortages, and who needs to step in to address this lack of medical supplies in the first instance?
You are right. This outbreak happened after another one that was declared over last year in November. So there weren't a resupply of the stock that were used during the 16th outbreak, and that caused a stock out in a couple of areas in terms of personal protective equipment. And I would call for everybody's efforts to ensure that the healthcare workers on the ground have enough resources, including the personal protective equipment, to ensure this outbreak is contained well, but also to ensure the continuity of regular health services before they collapse.
So, and obviously, you know, for the healthcare workers, this is absolutely critical. The Red Cross announced the deaths of 3 healthcare volunteers in May. This is difficult. You know, to control this outbreak, you really need those supplies. We've also seen Ebola treatment centres being attacked by protesters. And I think this is really important that we just sort of, you explain perhaps why there is this frustration, this lack of trust with authorities on the ground. Can you just explain a little bit further?
There are a couple of factors that contribute to reduced trust, and that include specifically misinformation and rumors with Ebola, we have to isolate patients to ensure that they are taken care in a proper way and avoid transmission to healthcare workers, but also other members of the community. And that isolation sometimes causes rumors and stigma toward the community. And those rumors are fueled by the social media spread widely and creating doubt within community about the reality of Ebola. That's one of the factors that are causing resistance in community. Another factor is related to the trust into the response system and the healthcare as a whole, especially that healthcare workers are being also affected, and there are some scale down in some places of regular health services that further erode the trust of the community toward this outbreak response. And that is some of the factors that we are working on to ensure that we engage the community and give them the real information about the Ebola and stop the misinformation and rumors.
Good to have you, sir. Thank you very much.